Hello, friends. If you are on Medicare and you spend 2, 3, or even 4 nights in a hospital, you may assume you were officially admitted as an inpatient. That assumption can be dangerously expensive. A hospital can keep you in a bed, give you medication, run tests, bring you meals, and have nurses checking you around the clock, while Medicare still considers you an outpatient under observation. And if you need rehabilitation or skilled nursing care after discharge, those hospital nights may not count toward the 3-day inpatient stay that original Medicare usually requires before it will cover a skilled nursing facility. That one word, observation, can be the difference between Medicare helping with your rehabilitation and your family receiving a bill for thousands or even tens of thousands of dollars. Today, I am going through 5 things every Medicare patient and family member needs to know. How to find out your official status, why 3 nights do not always equal 3 inpatient days, what notice the hospital should give you, when you may have a right to appeal, and exactly what to ask before you leave the hospital. Before we get into it, subscribe to this channel right now and turn on the bell. Medicare rules change, hospital billing rules are confusing, and the hospital will not always stop at your bedside and explain the financial consequences in plain English. The people who know what to ask can act before discharge. The people who do not know often discover the problem when the rehabilitation bill arrives. Subscribe now and let's get into it. Rule No. 1. Ask whether you are officially inpatient or under observation. This applies to every person with original Medicare who is treated in a hospital, especially anyone who may need rehabilitation after a fall, stroke, surgery, infection, or serious illness. Being physically inside a hospital does not automatically make you an inpatient. You become an inpatient when a doctor formally admits you and the hospital processes that inpatient admission. Observation services are normally billed as outpatient care, even if you stay overnight. Do not ask, "Am I staying in the hospital?" Of course you are. Ask the exact question that matters. Am I officially admitted as an inpatient, or am I receiving outpatient observation services? Then ask the nurse to show you where that status appears in the record. Ask again every day, because status can change. Here is why the difference matters. Under original Medicare, observation care is generally covered under Part B, not Part A. That can change deductibles, coinsurance, and how self-administered medications are billed. But the bigger risk is what happens after discharge. For Medicare-covered skilled nursing facility care, you usually need a qualifying inpatient hospital stay of at least 3 consecutive days. The day you leave the hospital does not count. Time in the emergency room does not count. Observation time does not count. You can sleep in the hospital for 3 nights and still have 0 qualifying inpatient days. Rule No. 2. Count inpatient days, not calendar nights. Imagine that Mary arrives at the emergency room Monday afternoon. She is placed under observation Monday night and Tuesday night. On Wednesday, the doctor formally admits her as an inpatient. She stays Wednesday night and Thursday night, then leaves Friday for rehabilitation. Her family may say she spent 4 nights in the hospital. But for the usual original Medicare skilled nursing rule, she had only 2 inpatient days before discharge. Monday and Tuesday were observation. Friday, the discharge day, does not count toward the 3-day minimum. Now look at the possible financial difference. In 2026, when you qualify for Medicare-covered skilled nursing care, days 1 through 20 can cost you $0 per day after the applicable Part A deductible for the benefit period. Days 21 through 100 carry a standard coinsurance of $217 per day. But if you do not meet the coverage requirements, Medicare may pay nothing for the skilled nursing stay. A facility charging $400 per day would cost $12,000 for 30 days. At $550 per day, 30 days would cost $16,500. Local rates vary, but the point is simple. One classification decision can affect a 5-figure bill. There are exceptions. Some Medicare Advantage plans waive the 3-day requirement, and some providers participating in approved accountable care organizations may use a 3-day rule waiver. Never assume the exception applies. Ask your Medicare Advantage plan or care team directly. Does my plan or ACO waive the 3-day inpatient requirement for this skilled nursing admission, and will you confirm that in writing? Rule No. 3. Watch for the Medicare Outpatient Observation Notice. Hospitals are required in many observation cases to give Medicare patients a written notice called the Medicare Outpatient Observation Notice, commonly called the MOON. The notice explains that you are an outpatient receiving observation services, and that this status can affect your costs and skilled nursing coverage. Do not treat the MOON as routine paperwork. Read it. Ask when your observation status began. Ask whether a doctor is considering inpatient admission. Write down the name of the person who explains it. Ask for a copy before signing anything. Use this exact sentence. Please explain how my observation status affects my hospital charges, my medications, and my eligibility for skilled nursing facility coverage after discharge. If the answer is vague, ask for the hospital's utilization review or case management department. Those are the people who deal with patient status and discharge planning. A signature on the MOON generally confirms that you received the notice. It does not necessarily mean you agree with the classification. You can write notes on your copy about the time you received it and the questions you asked. Keep that document with your discharge papers. Also ask who is responsible for any medications you normally take at home. Under observation status, some self-administered drugs may be billed differently. Ask for a written medication charge estimate and compare it with what your Part D plan would normally pay. A familiar pill can become an unexpected hospital charge when nobody checks the billing category. Rule No. 4. Know when a hospital status change may be appealed. A newer protection applies in certain situations when a hospital first admits a Medicare patient as an inpatient and later changes that person to outpatient observation. Medicare now explains that eligible patients can request a fast appeal while they are still in the hospital. After receiving the Medicare Change of Status Notice, Form CMS.0568, this is not the same as simply disagreeing with an initial observation decision. The appeal right described here is tied to specific conditions, including a change from inpatient to outpatient observation. The notice should explain the deadline and who to contact. These deadlines can be very short, so do not place the notice in a folder and wait until next week. Say this immediately. I want to know whether I qualify for the fast Medicare appeal of this change from inpatient to observation status. Please give me the written notice, the appeal deadline, and the Quality Improvement Organization contact information. You can also call 1-800-MEDICARE, which is 1-800-633-4227, and ask for help understanding your appeal rights. Do not argue only about money. Explain the medical facts. Was inpatient level care ordered? Did you need frequent monitoring, intravenous medication, oxygen, complex testing, or treatment that could not safely happen elsewhere? Ask your physician to document why the care was medically necessary. Documentation matters. Rule number 5. Do not leave the hospital without a written coverage plan. The most important moment may be the discharge meeting. Families are often tired, frightened, and trying to arrange transportation. That is exactly when expensive assumptions happen. Before transfer to a skilled nursing facility, ask the hospital case manager 5 direct questions. First, how many qualifying inpatient days are documented? Second, does the discharge day count? The answer is generally no. Third, has the skilled nursing facility confirmed that Medicare will cover this admission? Fourth, if Medicare does not cover it, what is the daily private pay rate? Fifth, are there other covered options such as home health care, Medicaid, veterans benefits, an ACO waiver, or a Medicare Advantage plan waiver? Ask for the answers in writing. Get the facility name, the expected start date, and the person who verified coverage. If the facility says Medicare should cover it, respond with, "Please tell me the exact coverage basis and what I will owe if the claim is denied." Also remember that meeting the 3-day rule does not guarantee unlimited nursing home coverage. The facility must be Medicare certified. You must need daily skilled care, and Medicare coverage is limited. Original Medicare generally covers up to 100 skilled nursing days in a benefit period when all requirements are met. In 2026, days 21 through 100 cost $217 per day, which could total $17,360 for days beyond 100 are your responsibility. This is short-term skilled care, not open-ended custodial care. If you already received a denial, do not throw away the Medicare summary notice. Read the appeal instructions and deadlines. Ask the facility for the medical record, admission orders, status notices, and billing codes. Call 1-800-MEDICARE and say, "I need help reviewing whether my hospital stay and skilled nursing claim were classified correctly, and I want the deadline for an appeal." So here is the full picture. A hospital bed does not automatically mean inpatient status. Observation nights generally do not count toward Original Medicare's usual 3-day skilled nursing requirement. You should ask your status every day, read the moon, respond quickly to any inpatient to observation change notice, and leave the hospital only after the coverage plan and possible private pay costs are clear. The hospital may focus on your medical discharge. The skilled nursing facility may focus on getting you admitted. Medicare will apply the written rules after the claim arrives. The person who protects your family from a surprise bill is often the person who asks the right question before the transfer happens. Subscribe, share this with someone you know who is on Medicare, and I'll see you in the next one.